Welcome Dr. Ashwani to our show, My Two Cents.
Hi, good evening.
Good evening. Good evening, sir. So as this episode is focused on allergy management in ENT, so let us start with a very basic question. What is allergy for a layman to understand?
Okay, so it's a very pertinent question and a very good question. So it's like, a very widely used term, allergy. For even if you ask roadside people talking about allergy hai and all those things. So allergy is basically a hyper response of your body to certain things which your body doesn't like. It can be anything. It can be like perfumes, dust, pollens, grasses, fungus. You can be allergic to most of the things in like the environment when what we are exposed to. So the body responds in a exaggerated way, and that is called allergy.
Okay. Can you also tell what are the different symptoms for the allergy that people can experience?
Yeah. So most of the time, when the person is exposed to allergens, so he will have a symptoms of allergy. And how do the symptoms react, or how the patient presents with the symptoms is basically when you have nose symptoms, you have pulmonary symptoms, you have skin issues. So there are different systems are involved. So body responds in a different way. The common when the aeroallergens goes inside the nose. So basically there is an inflammation keeps on happening inside the nose. As in there are many chemical mediators which releases some of the chemical substance which causes running nose, itchy nose, watery eyes, itchy eyes, stuffy nose. So you have a blocked nose. So when you have a more severe way of allergy presentation, it can present in breathing issues like an asthma kind of a pictures. When you have a contact dermatitis, you have a itchiness on the skin, and all those things can present as allergy patients.
So sir, what all can be done to prevent the allergy problems?
Okay, so very good questions, and in fact it's very hard to prevent or cure allergy in one way. So basically the most important thing is the avoidance of triggers, basically what we call it as. So whatever things which is triggering your allergy symptoms, you try to avoid those things. You try not to be in contact in those things. Okay. So, and the only way we can avoid things by once we know that we are allergic to these many things.
Correct.
Okay. And to know what we are allergic to, we need to have a proper investigations and a detailed investigations to find out what we are allergic to. Okay. So once we know that we are allergic to these many things, so we can work on those things.
Correct.
Okay.
Correct.
And some things are which can be avoidable, like food items and many things, contact things we can avoid. Right. But the environmental aero allergens we cannot avoid. These are in the atmosphere, you cannot escape those things come in contact. So for those things, it's very difficult to avoid and control these things. But we have recent advances and therapy for all those patients. We can control and have a good control of allergy.
Okay. Sir, so what are the different treatment options available to treat allergy? Can it be permanently cured or not? This is a very basic question that people keep on asking.
Yeah. So most of the times patients come with the hope of that, sir, कि क्या मेरा allergy ठीक हो सकता है, sir, and all those things. So that is permanently cure is a very tough question to answer to any patients, because allergy is a genetic disease. Okay, it runs in heredity, it runs in families basically. So you will often see that father and mother is having allergy, the children will also have symptoms of allergy. So it's a genetic disease. It's very hard to cure this type of a problem, but the more the science is getting advanced and the more we are going in detailed depth of treatment of allergy or the cure of allergy, we are trying to find out things we can alter the tolerance of a patient's body towards that allergens. So in that way you will have a good control of allergy once we find out the allergens, what he's allergic to, going for something called immunotherapy, that is what is called sublingual immunotherapy. So that means we are giving the allergens in a diluted, titrated way to the patient, so that the body slowly gets resistant to those allergens. The body gets immune to those things. And in other way, we are increasing the tolerance of a patient's body to that allergens. So in one way, like for long treatment, it's like 1.5 to 2 years treatment we give for sublingual immunotherapy, and thereby the patient develops resistance to those allergens, and he will have a good control of allergy for 10 to 15 years. So that's one way of controlling allergy. And the best way is you do something called gel neti, using sprays kind of a thing, avoiding of triggers and all those things. So you will have a good control of allergy, and there are many literature supporting of if you can control of vitamin D has a role, probiotic has a role to play. So these are many multifactorial things which we can work on and have a good control of allergy, and you can say that's near cure to the allergy problems.
Okay, thank you, Dr. Ashwani. Thank you for your wonderful answers. I think you made it so easy for all of us to understand the allergy management in ENT. But before you leave, I have one thing to ask from you. What are your 2 cents for the general physicians who are treating allergy patients and trying to treat the patients in the best possible way?
Yeah, thank you so much. It's my pleasure to answer some 2 cents to the general public. So my 2 cents will be for the physicians, once you come across a patient who has allergy issues, you should be explaining to the patients properly that what are the different treatment options available in today's scenario. So they should not be devoid of any treatment and should not be under treated or ignore it kind of a thing. तुम्हारी allergy है, तुम्हें कभी ठीक नहीं हो सकता, you live with it. It's very hard to say somebody. So we work as a team. So as a physician, when we are seeing this, so they should refer the patient to some allergy specialists, some nearby. They can always open for the advice for us, so we can also guide them how to go about. So the common things that they can inculcate to the patient, the common masses, so that will be a good outcome for the allergy. And it's a very social nuisance for a patient who having allergy all the time, sneezing, running nose, and all the stuff he knows. So we can improve the quality of life of a patient when somebody is having allergy. So the awareness to the doctors, awareness to the patient, public, the mass awareness is very important. And we should not be going in one line of a treatment spray when we have other options also available. So in the form of immunotherapy or monoclonal antibodies, which are all there in today's, so science is getting advanced and we are also learning a lot. So when we work as a team, we can do good to the patients actually. So that is the 2 things. It's a team game actually, and the patient and the doctors both work together to get control of allergy. It's not only the doctor has to work hard. The patient also has to be diligent in doing gel neti and doing controlling things. Okay. So that are my 2 cents, and hopefully we'll do something for the betterment of the society. That's what we can do. That.
Yeah, great, sir. Great to hear you, and thank you for the insights for our patients and for the general physicians. And thank you very much for your time for our show.
Thank you. It's my pleasure, sir.